Hello everyone, in this video I am going to talk about the surgical anatomy of the rectum. So what is the length of the rectum? The length of rectum is equal to 12 to 15 centimeter. So the length of the rectum is equal to 12 to 15 centimeter. The rectum has three lateral curvatures. Three lateral curvatures from right to left to right. Okay, what is their orientation? The orientation of these curvatures is right, left, right. The mucosal aspect of these curves are marked by valves. What are these valves called as? These valves are called as Houston's valve. What are these valves called as? These valves are called as Houston's valve. These are semicircular folds, but they do not have any specific function. So the rectum is divided into the three parts: upper 1/3, middle 1/3 and lower 1/3. Upper 1/3, middle 1/3 and lower 1/3. The upper 1/3 is covered by peritoneum. The upper 1/3 is covered by peritoneum from front and lateral side. Okay, so the upper 1/3 is covered by peritoneum from front and lateral side. The middle 1/3 is covered by peritoneum only from front. Only from front. And the lower 1/3 is devoid of peritoneum. There is no peritoneal covering in the lower 1/3 part of the rectum. Devoid of peritoneum. So upper 1/3 is covered by peritoneum from front and lateral side. The middle 1/3 is covered by peritoneum only from front, and the lower 1/3 is completely devoid of peritoneum. There is no peritoneal covering in the lower 1/3. The lower 1/3 of the rectum. Lower 1/3 of the rectum has prostate in the front and sacrum and coccyx behind. Okay, the lower 1/3 has prostate in the front, and it is separated from the prostate by a fascia. The lower 1/3 of the rectum is separated from the prostate by a fascia which is called as Dino-Wheeler's fascia. Dino-Wheeler's fascia. And on the back side, it is separated from coccyx and sacrum by a fascia which is called as Waldear's fascia. Okay, so in the front it is separated from the prostate by Dino-Wheeler's fascia, and from the back side it is separated from sacrum and coccyx by Waldear's fascia. Now let us talk about the arterial supply of the rectum. So the rectum is supplied by 3 arteries. Number 1, superior rectal artery. Number 2, middle rectal artery. And number 3, inferior rectal artery. So the superior rectal artery is a branch of inferior mesenteric artery. Sorry, it is a continuation of inferior mesenteric artery. It's a continuation of inferior mesenteric artery. It is a continuation of inferior mesenteric artery, and it is the main artery supplying the rectum. It is the chief artery of rectum. The second artery is the middle rectal artery. Middle rectal artery, it is a branch of internal iliac artery. And the inferior rectal artery, sorry, it is inferior rectal artery. The inferior rectal artery is supplied by, it is a branch of internal pudendal artery. Okay, so the arterial supply of rectum is via 3 arteries: superior rectal artery, the middle rectal artery, and the inferior rectal artery. The superior rectal artery is the chief artery supplying the mucosa of the rectum, and it is a branch of inferior mesenteric artery. And the middle rectal artery, it is a branch of internal iliac artery, and the inferior rectal artery, it is a branch of internal pudendal artery. The venous drainage is via 3 veins which have similar names like the arteries. So just remove the artery and put vein here. Superior rectal vein, middle rectal vein, and the inferior rectal vein. Superior rectal vein. Superior rectal artery is the branch of inferior mesenteric artery. So superior rectal vein, branch of inferior mesenteric vein. Inferior mesenteric vein which drains into portal circulation. The middle rectal vein, the middle rectal artery was a branch of internal iliac artery, and the middle rectal vein drains into the internal iliac vein. Internal iliac vein. And the inferior rectal artery is a branch of internal pudendal artery. So similarly here the inferior rectal vein drains into internal pudendal veins. Now let us talk about the lymphatic drainage. So the lymphatic drainage from the upper half of the rectum is into the inferior mesenteric nodes. Inferior mesenteric nodes via pararectal nodes of Gerota and sigmoid nodes. Via pararectal nodes of Gerota and sigmoid nodes. Okay, so the lymphatic drainage from the upper half of the rectum is into the inferior mesenteric nodes via pararectal nodes of Gerota and sigmoid nodes, and the lymphatic drainage from the lower half of the rectum is into the internal iliac nodes. Okay, so this is all about the surgical anatomy of the rectum. Goodbye.